Hello, welcome to another video, and hopefully I will choose a good article to read this time, and you will enjoy the article. Um, it seems interesting. Memory for familiar and unfamiliar words. Evidence for a long-term memory contribution to short-term memory span. Um, so let's select port page. Yes, it seems interesting. Antipsychotic drugs, prolonged QTC interval, and sudden death. The authors reviewed the mechanisms and established the risk of torsade de pointes and I'm not sure how to pronounce this sudden death with antipsychotic drugs, but it seems quite interesting because probably you never heard of sudden death and its relation to antipsychotics. They present a review of original concepts, the distinction between familial and drug-induced cases of torsade de pointes, and recognition of the role of non-cardiac drugs in torsade de pointes and sudden death. They review evidence linking QTC interval prolongation, potassium channels, and torsade de pointes from both the long Q2 syndrome and drugs. They examine the risk for torsade de pointes from antipsychotics and estimate the frequency of sudden death on the basis of epidemiological data in normal and schizophrenic populations. For some books saying schizophrenic is not good, like schizophrenia patient is better than schizophrenic because people use it to insult someone, I guess. So results, let's read the results. All drugs that cause torsade de pointes prolong the Q2C interval and bind the potassium rectifier channel, but relationship are not precise. Prediction of torsade de pointes and sudden death can be improved by examining dose dependency, the percent of QTC intervals higher than 500, and the risk of drug interactions. Although sudden unexpected death occurs almost twice as often in populations treated with antipsychotics as in normal population, there are still only 10 to 15 events in 10,000 person years of observations. So it seems it's not that common, but it's still possible. There is no association with that type of antipsychotics. That antipsychotic does prolong the Q2 Q interval, and there is no evidence to suggest that this leads to torsade de pointes or sudden death. Only widespread use will prove if it is entirely safe. To date, all antipsychotic drugs have the potential for serious adverse events, such as sudden death. Balancing this risk with the positive effects of treatment poses a challenge for psychiatry. So, it seems quite interesting. And it's still not very clear if it leads to sudden death. So they mentioned that in 1963 sudden arrhythmic death so also how antidepressants have had cardiac effects in some studies. That's interesting. So I will read the conclusion part. I think there's no conclusion for this journal, or let's read. I think this might be the paragraph that I'm looking for. Until we have more experience, it is good to ask apparently healthy patients if they have had syncope, if they have relatives with long Q2 syndrome, or if they have relatives who died suddenly at a young age. Among older patients, especially those with known heart disease or taking drugs that can prolong Q2, a pretreatment EKG would be appropriate. At this point in time, an atypical antipsychotic without concern doesn't exist. In order to balance this risk, so they're paraphrasing the previous sentence, the sentence in the abstract. In order to balance the risks and benefits of these drugs, the psychiatrists will have to add towards the pointus Q2C interval, potassium rectifier current, hypertriglyceridemia, serum insulin, and person years of observation to his or her vocabulary. Okay, seems quite practical and very good article published in 2001. And thanks for watching this video. I wish you have a beautiful day. Bye bye.